Assalamualaikum and a very good evening. In regard to the topic, yes, I agree to the statement that health communication via social media is effective in educating public. So today, I would like to present to you my point of view to support my agreement and hope every one of you will receive this message in your best being of health. As time goes by, when the diverse sets of technologies becomes more complex, the rapid growth of social media is inevitable and inescapable in all over the world. According to Kaplan and Haley in 2011, social media is a set of internet-based applications which facilitate the sharing of ideas, thoughts, and information through the building of virtual networks. Since the words effective means successful in producing a desired or intended result, social media may become the one that provides a variety of features that serve a wide range of purposes for the individual user, which includes blogs, YouTube, WhatsApp, Facebook, Twitter, Telegram, and myriad of other media. The upbringing of research discovery has shed light on the advantage of social media in any aspects of life, including to share any health information. In light of that statement, I strongly agree that health communication by social media is effective in educating public as it opens chances for people to receive answers about diseases and medical questions during emergency time, to relieve from any other diseases that public is being suffered, and to assist workaholic to their time constraint to consult their health. The main justification that health communication via social media is effective in educating public is because people may receive answers regarding diseases and any medical question during emergency time. Due to that fact, frequent social media like live tweeting, Facebook Live, or even through Instagram Live is the best platform in providing numerous opportunities for education. Messages like healthy guidelines could easily be spread. First, social media lets healthcare professionals pass along information released by organizations such as the Red Cross, WHO, CDC, or maybe even interact with television channels. In connection with such fact, social media has proved to be an extremely effective tool in times of crisis by providing information to consumers instantly, for example, during COVID-19 pandemic that currently occur in almost all over the world. In this case, hospitals and other healthcare organizations can easily update on hospital capacity, operation status, and emergency room access through social media network during natural disaster or disease outbreaks. Furthermore, social media may also be used as a medium for the healthcare professionals to impart the basic protective measure against the new coronavirus, such as wash hands frequently, maintain social distancing, avoid touching eyes, mouth, nose, practice respiratory hygiene, and others. This action should be practiced by those who are exposed to the outside who want to come back to their home safe and sound. In addition to this, according to Canopy 2019, Dr. Nur Amalina Bakri was always using her online presence to disseminate scientifically proven and accurate health information to debunk myths and fake medical news based on her own knowledge. Also, based on the current issue, Dr. Amalina Bakri denied the advice from Health Minister Dr. Adham Baber that people should be encouraged to drink warm water to prevent COVID-19 infection. This statement was produced by Dr. Adham Baber in an interview recently on TV1. In that interview, he said, as quoted by Malaysia Kini, the virus do not like heat, but please drink warm water. The virus will go down to the stomach and the acid in our stomach will kill the virus. She, who is concerned about misinformation surrounding the COVID-19 pandemic, immediately tweeted to explain that there is no evidence to back up such claim. Next, earlier of this March, the World Health Organization (WHO) has also rejected this myth, and the organization shared in their official Twitter account about it, explaining that it is good to stay hydrated, but it doesn't prevent the spread of COVID-19. Major healthcare authorities like WHO turned to social media networks like Twitter and Facebook to confront these challenges. They succeeded in rapidly communicating accurate health information to both health community and public in general. Media social is therefore being used by the healthcare professionals to educate public about health issues, and people would be more aware on not simply follow any myth and that they see floating online during emergency. The next justification that health communication via social media is worthwhile in educating public is to relieve from any other diseases that public suffered and to avoid any unexpected diseases. In movement control order MCO that conducted throughout our country, as for example, people in the situation there too may have economic problems, since to go to the clinic becomes a daunting task to do during such situation in which to avoid themselves from making symptoms of COVID-19, these people may perceive their difficulties to consult their health condition when they get suffered by any other diseases which differ from COVID-19 symptoms such as psoriasis. Thus, through social media, prevention of psoriasis symptom by simply clicking the search button at the Facebook Live or YouTube channels, as for instance from Dr. Nordin Darus. To further strengthening the statement, hashtags are used on numerous social platforms including Facebook, Instagram, Twitter, and others. Hashtag first became popular on Twitter, introduced as a way to link conversation and commentary on similar topic for simplified user research and popularity tracking. With the continuous flow and discovery of health information, hashtag offer both patient and physician the ability to streamline their search across an entire social media platform. The utility of this hashtag is illustrated below by a volunteer organization, the Breast Cancer Social Media, hashtag BSCM community. Using the hashtag, breast cancer sufferer can search hashtag BSCM and access an entire world of support, guidance, and information. Due to one of real cases, there was a person asked to Dr. Amalina regarding to the charcoal function in whiten the teeth, and according to Suryati 2018, in her Twitter account, Dr. Amalina writes, based on published studies, there is no evidence that charcoal can whiten your teeth. It cleans your teeth, but it doesn't whiten your teeth. It was vital to build awareness and preventive knowledge among healthcare practitioners and to the general public, including civilians residing in rural areas and remote areas. They needed to reduce the spread of misinformation related to treatment, risk factor, and prevention, especially in buying any products locally or foreign one. The final justification that health communication via social media is fruitful in indoctrinating public is to assist workaholics due to their time constraint, which refers to both patients and health practitioners. Medical experts are typically fully booked every day. Most of the time, medical experts are only able to spend about 15 minutes with each of their patients. In other words, after office hour, a doctor can have a lot of time to dig out one by one information telling to the public about a specific diseases without any rush to settle a queue of patients at his clinic by using his social media, so that any patient can be clearly understood about their real health condition. Therefore, with the presence of social media, it allows medical organizations to build connection and share their discovery during their free time. In line with that statement, Platforms like Twitter and Facebook, physician and health system are able to share relevant health alerts and receive patient feedback, where patients also may raise their questions to the live video. After working hours, while rest at home, patients can rely on social media for moral support from throughout the world and can access information related to their health problems and learn about other patient experiences. A quick Google search for scoliosis, for instance, yield millions of results. In some cases, the best way to learn about coping with a health condition is by swapping stories and advice to person on a forum. A lot of social media platforms set out to figure a way for a patient to manage their own health conditions. Patients may also directly keep in touch with their close doctors to consult their health. In spite of saving patients time, it is indeed save their own money. In short, even there is no emergency or any difficult times for people to go to the clinic by themselves, social media can serve as an effective means of communication for healthcare providers and patients. In a nutshell, social media may become our first choice to receive the medical news and understand clearly regarding our health condition so that we can try to make a step to relieve any symptom of any diseases. However, we have to put in our mind that not all of the diseases can be treated easily by ourselves, where some of the diseases, especially the symptoms of severe diseases, require an immediate consultation to the medical expert to avoid any high risk to our health, such as misused medicine. Social media may only be the platform for the patients about the truthfulness of public health condition. Thus, sufferers of any other diseases can make their first step to do their own research throughout social media to avoid and relieve any related symptom effectively. Allah commands in Al-Quran, "So high above all is Allah, the Sovereign, the Truth, and O Muhammad, do not hasten with recitation of the Quran before its revelation is completed to you, and say, My Lord, increase me in knowledge." Surah Taha, verse 114. From the verse, it is very important for Muslims to increase their knowledge, and science along with technology is part of knowledge. Thus, social media as a product of knowledge should be embraced by all Muslims. Utilize it as it best and use wisely.